Hi there, this is David Hanson Bartholomew again from the Physiotherapy Rehabilitation Centre, and I'm here with one of my almost former patients. She's still a patient and we're still working with her, and she's practically at the summit of her rehabilitation, almost there. But this is the wonderful Tracey. So Tracey, I just want you to just, tell us a little bit about yourself, what you do, right? And what actually brought you to us here at the Physio Rehab Centre.
Right, okay. So I'm now working as a carer.
Right, okay.
But I didn't do that. This is like a recent thing, as in the last 2 years.
Yeah.
But before that, in optics.
Right.
How it started was I had a baby.
Right, okay.
Who is now 30.
30 years old.
30 years old.
Wow.
And, well, the one that broke me.
Yeah.
Not her fault, just happened.
Yeah.
And it's been going on for 30 years. I had a steroid injection into my pubic bone that didn't work this time round.
Right.
So then it was like, right, you need physio.
Right, okay.
First time ever, even though I had been like ages ago, I'm talking years ago, I never had this proper physio, I didn't have proper physio. They made me sit in a ball and I couldn't even sit in a ball.
Right.
And then it was like, okay, go sit in a ball and off you go, bye.
So what was the pain like?
Horrific.
Really?
Like I'd have to sit on a rubber ring with my knees tied together.
Wow.
Yeah.
So
that was for months, mind. That wasn't just like, that was months.
Wow.
Months and bedridden.
So you were bedridden?
Bedridden.
So how long were you bedridden for?
Solid pregnancy, and then a couple of months after, and then I had to have heparin injections, which I did myself.
Right.
And then trying to walk then, it took ages, and then I saw a chiropractor.
Right.
And that's how I initially got on my feet, was through a chiropractor every week.
Right.
For 7 years.
For 7 years?
For 7 years, yeah.
Right. So did you have any treatment after the chiropractor?
Not until, I think my daughter must have been about, it was about 7 or 8 when I had my first injection.
Right.
And that was because I changed surgeries.
Right.
Because the one surgery didn't do anything, and when I went there, in all fairness, they did send me straight up then to an osteopath.
Right.
A consultant, and then I had my first steroid injection into my pubic bone.
Right, okay. So basically, we're just looking at what transpired with Tracey here now. Is a bit of an example here. We have the spine here, just to orientate you. You've got here the back of the skull, this will be the neck, this will be the thorax, where your rib cage attaches, the lumbar spine area, and then you have the pelvic area here. So the pelvic area, obviously, this is where the womb is, and this is where the baby grows. Now, if you look around the front here, okay, what you've got is the pubic bone. Okay, now the pubic bone, okay, is called the pubic symphysis. Now, during pregnancy, you get a softening of all of the ligaments and the joints in the body. And sometimes some women suffer with this becoming too loose, this area here. So this cartilage here, you can see it's flapping in the breeze, basically loses its hold. And so what can happen is this can actually come right apart. And this is what they call pubic diastasis, which means it separates. And so how far into your pregnancy did that happen?
3 months.
3 months?
3 months.
So you had 6 months bed rest.
Bed rest, commode. Bed rest, commode.
Okay, and then thereafter, that's when they tried to fix you together and get things after you postpartum.
Postpartum, not before.
Okay, and so you were experiencing pain since then?
Yeah.
Okay.
Yeah.
Right. So where did things change?
They changed. I had that electric thing.
The shockwave therapy.
The one, yeah.
The medical name is Focussed Extracorporeal Shockwave Therapy, acronymed FESWT.
Electric stuff.
Yeah, electric stuff. It's just shockwaves into the area of complaint. Okay?
Yeah.
And we did about 5 sessions, I think.
5 sessions, and it got me on my feet because what it was, I had this time how it had gone.
Yeah.
I got into a car and somebody slammed on the brakes, and the seatbelt was actually
Alright,
there.
around the pelvic area.
And then it started, and then I thought, here we go, but the injection didn't work.
Right.
This time round, and it's the first time ever it's not worked. And then I thought, right, okay, now I'm stuck. However, then I had this, and that, like, brilliant.
Wow.
Considering, do you know what I mean?
Yeah,
normally I would have been down and out waiting for the next injection, which is emergency, and this is 6 months.
Wow.
Like, even paying, you're talking like 6 weeks, whatever, okay, fair enough, but when you're in pain, 6 weeks is a long time. 6 months is a really long time.
So you're talking about having pain, this pubic symphysis dysfunction,
Yeah.
from when your child was born, is that right?
Yeah.
So 30 years
Before.
before, of course. Yeah.
Before.
So all that time, and now there's
Hardly any now.
Yeah.
It obviously because I've got a manual job,
Yeah.
until I'm 100%, like you said, nearly there,
Yeah.
then, I expect it.
Yeah.
I didn't expect to be this good,
Right.
this quick. I didn't expect to be good.
Yeah.
Do you know what I mean? Let's be fair, you don't. You think, but, because I'm cynical. But, no, really, really good, hell of a difference. So, like, whereas the pain coming in would have been about 9.5, it's not even. It's like, if it peaks, it's like a 3,
Right.
which for me is like, woo.
Fantastic.
Yeah.
So let's say 0 would be no improvement, 10 is 100% improvement. Where would you put yourself on the scale?
Oh, 100% improvement compared to what it was.
Fantastic.
Yeah.
And would you recommend individuals to come see you?
Yes, I've told everybody. Like, literally told everybody. I said to somebody in work today, you need to go put your knee, mate. And she said, no, I did wind it up. She said, oh, what's he doing? Well, he hooks you up to this machine. I said, you don't feel it. I said, it's like me. Nothing.
Yeah.
It's like, it doesn't. You don't actually feel it. I expected at least some kind of zzz.
Yeah.
And I thought, wait for it. Is that it?
Yeah.
So, yeah.
No, so fantastic. We are so pleased that Tracey has made such improvement, and we are continue on, sort of like, taking her to the summit. She's going to get there. So, hey, give us a call.